Good. What's up?
Nothing. I went grocery shopping, so I'm
Did you?
like rushing back. Yeah. Um, do I need a yoga mat?
Yes.
Yeah. Okay. Hold on. I'm here. Okay. I got my lacrosse ball.
Okay. Oh, good.
I have resistance bands. I don't know if you want
Okay.
to add this in. Yeah. I'm coming. I'm coming. I'm coming. Can you hear me?
Yeah, I can hear you.
Do I need sneakers? I'm good.
No, you're good.
Okay. All right. So
What do you want to do
you
first?
can um
Introduce myself?
yeah, tell them about you, how cool you are.
All right. What's up, everyone? My name is Tina, aka the Stretch Boss. So, for those of you who don't know me, I am a licensed physical therapist assistant and a recovery specialist. And so, I majority of the work that I do is with I deal with your average Joe, your weekend warrior,
Everyday people.
every, and I help them recover. I help them get out of pain, inflammation, rehab through injuries. But today we're going to be talking about recovery.
Yeah.
So
Um
it's up. I know you guys train with Neeks, where you follow her. I hope you train.
this week, all right, so this week my body is like, I think Friday I was just like, I need a break.
Oh, really?
And yeah, I was just like, yo, I need to lay down and just like sleep.
Okay.
So I ended up rescheduling the 6 p.m. live to Saturday morning because I just needed one day to just
Okay.
really rest. But
Hmm.
I feel much better. My body is definitely sore, like total, like everything is sore. Like I miss you.
So you know the thing called CNS fatigue, right? Have you heard of
Uh-huh. Um, I don't think so. If you didn't teach me about it, no.
So it's called central nervous system fatigue. So what happens
Uh-huh.
is when you're constantly training, your adrenals tend to drop down. So they go into overload and then
Mm-hmm.
just fall. So a symptom of that is when you start to get, when you feel like you're tired and then you feel sluggish when you get out of bed the next day. Like you just don't feel normal. Like you're always on the go, go, go. And then one morning you wake up and you're like, what happened? Like I feel like I just got hit by a truck or I'm super tired
Mm.
when you're normally not tired. Another thing is for people who lift weights or when you're working out, if you get fatigued really fast, if you're weight training and you notice maybe you lift, you're curling 20 pounds or 25 pounds, and then all of a sudden that thing feels like it's 50 pounds and you have to decrease the weight to make to maybe like 10 or 15 pounds, then that's a sign that you need to stop and that you need to recover. So rest is always the big one. And then obviously like vitamin D, things of that nature, that's going to help boost your adrenal system. And then obviously water. Everyone knows water. Water's a,
Yeah.
yeah. So when you're messing with tissue and you're trying to do recovery work, when you're doing foam rolling, you got your little foam roller. I see it.
I got it.
Yeah.
We got the same one.
So when you're doing foam rolling, you always want to make sure that you're hydrated. So anytime
Okay.
you're doing tissue work on your own, not to mention like when you come to see me, but your body is about 70% water. And so when you're dehydrated, that's when the foam rolling and all of this stuff becomes painful. So people
Mm.
roll because they get on the foam roller and they say it hurts like hell. and then they do it for like 30 seconds and then they stop doing it, it's because your tissue is so dehydrated and it's not, it doesn't have the proper nutrients, and plus it's not used to getting tissue work done. So the more you do foam rolling, the more you do like mobility work, then the better your body's going to get at it. So like when I first started foam rolling, I would do like maybe a minute, 30 seconds, and then I got better at it. But I used to get bruising on my legs really.
Mm.
Then I was like, I had to Google it because I thought there was something wrong with me. And I was like, what the hell's going on with this?
Is it like poor circulation?
Poor
Yeah.
circulation, and just the bruising is just your tissue is just not used to that pressure. So then, I mean, after a month of doing it consistently, I was doing it like every other day. Then I would get on the phone. Like this is a foam roller I use for like my clients. My daughter uses this, but the one I have has spikes on it. I can go on.
Someone else told me about that recently. Like I need to get it.
Yeah,
Do you have it close so you can show
yeah,
me?
yeah. I'll get it. It's in the other room. I'll get it.
Okay.
So this is the one I have.
Oh, okay. Where'd you get it?
You can get from Rogue Fitness.
Okay.
Other stuff I get is from Rogue.
Okay.
So eventually you can work your way up to this one. So you can start off with this one and then work your way into this one.
That
And then,
one looks really intense, but it's like good.
yeah, exactly. So I started off with something like this, and even this was painful. And then now I can just roll on this and I'm good.
For you know how my hamstrings are always like tight. For me, should I work with this for like a good month and then
Yes.
I
And
mean
then,
by the end of the month get that one.
uh-huh. And once you're
Okay.
able to do this for like over 2 minutes and you feel like you're good, then you know you need something a little bit more aggressive, and then you work your way into this.
Can I be honest? I think I'm good off of this one already.
Yeah. So then you
I'm
yeah,
gonna just get it.
these then.
Okay.
Yeah.
What other question I had for you? So you know my ankle, like the problem with my ankle. Basically, you said it's my you made a video for me.
Yeah.
So, I know it's on my page, like most people probably didn't watch it. It's on my other page. It's on your page. I didn't post it on this page. But
Okay.
just like explain to them and we can kind of like go through it just to show them like how you actually like helped
Do it.
me. Yeah.
Yeah. Okay. So her issue that she has is that the front of her ankles are tight, right? And then you can't do a calf raise, right? You can't go on your
I
toe.
can't go completely. So, see this one? All right, I'm gonna go all the way.
Mm-hmm.
So, like for this one, it definitely got better, but this is it. This is
Yeah,
it. And I feel it on the other side too.
on the
So,
back.
like, yeah, like right here.
So she's tight there. So that's where you want to do some of your tissue work. But you want to do, let me go on the floor here. Okay.
It sucks being in quarantine because I can't come to you and actually have you show me
I know. And we're
or
all
work on me.
treated with our stuff. Okay. Okay. So you're going to work all of this, like your peroneals, this
Okay.
in here.
Okay.
And what you also need to work on is basically when you go on your toes, when you're doing that motion, when you're doing this,
Mhm.
right? Yes, you're using your calf to get you up there, but
Mhm.
also you need to have this part stretched out. So it's actually
Okay.
front that's tight. If that
Okay.
Because if this is shortened in this position, how are you going to get up?
Okay.
Because it's kind of blocking. So that's when I told you we're gonna open up the back. So you're gonna foam roll. We'll start with the back first. We'll start with the calf because that's what everybody's like familiar with.
Okay.
So you can go up and down, right?
Wait, they can't see me. Hold on. Perfect.
So what I like to do, this is for the beginners. Yeah, you can roll up and down. And then anytime you do, I'm going to get my phone. Anytime you do tissue work, you want to do 2 minutes.
Okay.
Okay? It takes 2 minutes to make change to tissue. Anything less than that, you're not doing anything and your body really isn't making any type of change. So it sucks, but you got to have a timer with you because if you're doing 30 seconds, even when you're stretching,
Mhm.
it's going to be meaningless if you do it for like a minute and don't do anything.
Yeah.
You ready?
Yeah.
All right. So you'll go up and down. And then,
Definitely feel it.
yeah. And then for you, you want to like bring your toe up, right?
Like pointed back to my face
Yeah.
or just
Your
okay.
face. And then point the toe down. And wherever
Okay.
you feel there's like a sticking point where you feel the most pain, you hang out,
That.
press
Okay.
down, and then turn side to side like this.
Woo.
Feel
Mhm.
and try to do it with your toe pointed down inside. And then you can even go invert. So point your toe down and then turn your toe in towards the midline. Yep. Feel that?
Mhm.
Yeah. And then you kind of just hang out there. We're at 1 minute and 30 seconds. You still
Keep.
have,
Am I rolling or just
yep,
hang out? Roll.
down.
Okay.
And the whole point of rolling is you want to feel for funky spots. So like if you go over a spot and there's either a lump or it's super tender, that's the spot you want to hang out at. Don't like go away from it. Just kind of hang there. What you can do is if it's too tender, you take a deep breath, breathe out, and then sink into the foam roller. Good. All right. So that was 2 minutes.
Sheesh.
Do you feel that?
Yeah.
Yeah.
So I know where the spot is.
It's in the back.
Yeah.
So that's the part that you're going to try to attack.
Okay.
And you
And
should do
how?
it especially because you do a lot of plyometrics, like you do a lot of jumping. Sorry, guys, if you can't see me. And jump rope. So that's something that you probably want to do to open up the tissue before you jump rope.
Jump rope.
Like just get
Okay.
that real quick just to open it up because when you're jumping, that's a lot of
It's a
explosion.
lot of.
Yeah, and a lot of spring on the calf. So
Okay.
open that up so you can have less tension and then it doesn't bother you later on. And then at night
Okay.
you can go through the whole mobility routine, but just real quick before you go, just before you start jumping, just open that ankle up.
Okay.
And then a good thing we can go through it now is you can go through. They're called ankle cars. Actually, I'll sit and do it. So
Okay.
this is just working the joint, okay? Because if you feel a pinching in the front,
Mhm.
because the joints are banging together and they're not open. So you want to open this up if you're going to do lunging, because when you lunge, it's a lot of this motion, right? And
Yeah.
the joints are banging, so you want to try to open them up so you don't get that pinchy feeling.
Okay.
Same thing when jumping. So you're going to grab your leg. This hand goes underneath
Okay. Left hand. Wait.
the,
Right. Right. Or
yeah,
the outside. Okay.
this way.
Uh
Then
huh.
this one will go on top. So it's almost like if you're giving your knee a headlock.
Okay.
And then you're going to just do ankle rolls. So you're going to go point your toe up,
Hmm.
out, down, in.
Wait, so up,
Mm-hmm. Out.
on the outside?
Yep.
Okay.
Up, out,
Okay.
down, in, up, out, down, in. And the reason why we're doing this is because when you do it standing or even in like sitting, people take their hips for the ride. So like you think you're moving your ankle, but then the hip is going into the equation. So you just want to work the ankle, and this kind of isolates that, down.
I feel it all right here.
In your peroneals, right? Because they're super tight. And then you can go, if you want, opposite direction. So you're going to go down, in,
So down.
up, down, in.
Wait. So down,
Down, in,
in.
out, up,
Wait.
up,
Down,
down,
up.
in, out.
Do the other leg.
So it's just like you're doing the opposite. So down, in,
Okay.
down, in, out, up,
So down.
in,
So down, in.
out, because now you're bringing your ankle out.
Uh-huh.
Almost like if
Up.
you're in a circle.
Coordination.
I know. So the whole point of when you're doing, this is for the joints and this is for mobility. You see how like it takes coordination and you feel like some of your movements may be jagged?
Mm-hmm.
That lets me know that you don't have stability in the joint. So what happens is if you don't have a stable joint, that's how you can get injured. So you want to learn to control that movement where you can go clockwise, counterclockwise, and it's smooth. It doesn't look like this.
Yeah.
Like you're
Yes.
for stability. And then what happens there, like let's say, God forbid, you're jump roping and you do this number. You land and you go ahead like this, right? Because you do these drills, those ankle drills that I just showed you, it's going to help prevent injury because your body already knows what's it's like
How
to
to
be
react.
in that position.
Okay.
Because people get injured because you go in a position that your body or your brain is not used to. So that's how injuries happen. So when you roll your ankle, you don't walk on the outside of your ankles, right? But you just might so happen to step on something and it rolls your ankle inward. And then that's how you get, grade 2 or 3 tear in the ligaments or the tendons on the outside of the ankle. So to prevent that, if you do those exercises and those drills, if you ever do skip a step or if you're ever jumping, your body's familiar with that movement and it'll be able to recover faster, if that makes sense. You don't recover, you prolong your recovery when your body's not used to being in a position, in certain positions, and when you don't have enough blood flow or circulation to the area.
Hmm.
So that's why when we do recovery work, a lot of compression, compression is just this, pressing down on the tissue, right? Because you're compressing the tissue, and then when you get off of it, now you have fresh blood flow running to the
So
area.
tell them how long you're supposed to actually sit on
And
it.
the time, science says it takes 2 minutes to make change. So any type of tissue work, foam rolling work, I'll grab the lacrosse ball. Even when you're rolling your foot with the lacrosse ball, 2 minutes. Just set the timer for whatever position you're doing. So, and then you have to be specific. So like if you're rolling your foot, 2 minutes rolling your foot, 2 minutes doing your calf. Each thing is going to be 2 minutes.
2 minutes. Okay.
Minutes.
Even my hamstrings, 2 minutes each. Okay.
The goal is to do 2 minutes. I mean, some people might be more tender than others, so they'll do it for like 30 seconds and then it's like painful for them. But you want to try to stay
Push
and
through.
yeah, push through, stay in the area. I mean, you can take a break, inhale, exhale, breathe, but try to stay on it for 2 minutes to build the tissue tolerance because that's what it's all about. You want to build the tolerance in the tissue, and then that's how you're going to get better blood flow, better circulation, and then you're going to help prevent yourself from getting injuries. All right, we're going to
Got it.
do the lacrosse ball one for your foot.
Okay. This one, was this the one that hurts a lot? Guys, you're about to see. Okay, I'm stepping on it.
Yep.
Okay.
And we'll set the timer. So we're going to start off, you're going to roll side to side, cross friction, yep. You feel that?
Left to right.
Left to right, yep.
I definitely feel it.
Yeah. So
This is good for people if they're like on their feet all day, right?
yeah, I keep a lacrosse ball in my bag all the time.
Yeah, it definitely feels good.
Where you can roll on it, you can roll your hamstrings on it.
Mm-hmm.
So you can do stuff for your shoulders. All right, so side to side. Good. So I want you to put your heel on the floor. Put that heel
Mm-hmm.
and roll side to side.
Okay.
Left to right, yep. While your heel's on the ground. And think about grabbing the ball
Wait.
with your toes.
Okay. I was just about to ask.
Yep.
I feel it on the inside.
Yep. So we're at 1 minute and 30 seconds. Let me take this sock off.
Am I rolling out?
Yep.
Okay. Guys, just make sure you're breathing. That's one thing you did teach me. Even though it's hurt, like, remember the first time I met you and you're like, you have to just breathe.
So the reason why we tell, all right, 2 minutes is up.
Okay.
The reason why you need to breathe is because we want to activate your parasympathetic nervous system. So the parasympathetic nervous system is the system that calms everything down, right? So we don't want your brain or your nervous system to perceive anything as a threat. So when you breathe, you're working with your blood pressure, it's activating the nervous system, and it's kind of telling them, even though this hurts, right? Whatever I'm doing is hurting, I'm not in danger. So then it kind of allows you, that's when you get more mobility, you get better range of motion. When you have immobility or when people have lack of range of motion, it's because the body is either creating tension or your brain is creating tension. The muscles around it are spasming out and it's not allowing you that full range of motion because it's perceiving something as a threat, whether it's an actual injury or mentally something that's going on, your brain is not processing it and then it perceives it as a threat. So when you breathe, you know, a lot of people, I mean, we're always saying you as a trainer breathe. I'm saying it, but then people don't understand how important, like why? Why are you telling me to breathe? Okay, I'm breathing, but what's the point of it? The point of it is you want to calm everything down and teach your nervous system whatever I'm doing is not harming me, and then it'll allow access, that it'll allow for whatever I'm doing for you to get the best results. because if you don't breathe, then you're just going to tense up, and then it's
Your
your body
body's like rejecting whatever is like,
fight or
whatever,
yes,
what's the word? They know what we mean. Your body's just gonna reject the treatment,
yeah,
basically.
or whatever range of motion you, it's not going to allow me access. So like, let's say if you come into me and you have shoulder pain and you're stuck here, and I'm working, if you're not breathing through it and
It's
not,
gonna stay. Yeah.
it's going to stay here, or you may get a little but not as much as you should have gotten, because your body's like, I'm a little leery because I'm tensed up and it's not, I'm not comfortable with what's going on. So, and it's more so your brain and not your body. You have to send your brain that signal, and the way we do that is by breathing. So when you breathe, you actually activate your vagus nerve, which goes through your esophagus, and it's one of the longest nerves. But if you can activate that nerve, which you can do by breathing or gargling, it will calm everything down, and then it kind of gives you access to that nervous system. And then that's when you start playing with different ranges of motion, tissue, breathing, and then you're sending those signals to the brain. This is okay, what we're doing is fine, we're not in harm. And then the brain says, okay, cool, we're going to allow you this range of motion, we're going to allow this tissue to dissipate. When you have knots, everybody has knots, right? They're like, oh, I got a knot in my back, I got a knot in my hamstring.
Wait,
That's
I don't even think they know what not like some people. Let's be honest. Some people probably don't even know what you're talking about. Like,
like trigger points, or like if someone touches you and you feel a lump in your skin, right? Or like in the muscle. And then if I touch it, it's going to be tender. Sometimes the knots are so big, people can even feel it. Like I have people who have it like in the shoulder blades, and they're doing,
me.
and you can actually feel boom, 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 almost like that knot going over something, right? That's your body pulling on the fascia or creating tension in that area, which ends up coming to becoming a knot. And then because whatever's happening is it's perceiving it as a threat. So your body's going to compensate and pull and take from well, your brain is going to pull and take from other places. And then when that happens, you got muscles that are overworking, that are doing jobs that they're not supposed to be doing. And then so then they get pissed off, and then they become spazzed out, or it might just be too much load for that particular muscle. And so then that's how you create tension or knots or muscle spasm, which is always why it's important to do these things, to do this type of work, because you want to make sure each muscle is activating appropriately and doing what it's supposed to do in your movements or in your workouts. And these things, when you work out, like when you guys work out with Neeks, just assess your body. So if she's having you do a squat or having you do a lunge and you're like, oh, that hurts, or that's tight, or I did
Say something. Yeah.
like, but that allows you to know, oh, okay, tonight when I do my recovery work, I gotta work on this. When I was doing my lunges, my ankle was hurting me. Maybe I have to roll my foot out. You know what I mean? So then that's when you go through your workouts, that's also a way of you assessing your body. We're gonna do the front of your ankle.
Okay.
So you're gonna go here. And
Hmm.
then, yep.